Respiratory therapists. Who are they and what do they do? Do you know anyone who has been diagnosed with COPD, sleep apnea, or asthma? Have you ever wondered who treats these disorders and what causes them? My son was diagnosed with asthma as a child. This made me want to learn more about asthma and other respiratory-related issues, so I pursued an education in respiratory care. Respiratory care is a healthcare field that specializes in the optimal cardiopulmonary function and health. This means that the primary job of a respiratory therapist is the assessment, diagnosing, treatment, and education of patients with deficiency or abnormalities in their cardiopulmonary system. This is accomplished through oxygen therapy, mechanical ventilatory support, and administration of medical aerosols. The educational requirements to be a respiratory therapist include a minimum of an Associate of Applied Science degree in respiratory care. After completion of the required degree, the credentialing process begins. This includes 3 written board examinations. Upon completion and passing of the first examination, you are considered certified as a respiratory therapist by the National Board for Respiratory Care. The last 2 examinations are considered advanced practitioner examinations, and upon completion and passing of these, you are considered registered respiratory therapist. Respiratory therapists can also receive credentialing in pulmonary function testing, polysomnography, neonatal and pediatric specialties, along with other specialized fields. The NBRC has issued over 250,000 credentials to respiratory therapists since its beginning in 1974. Employment opportunities include hospitals or other acute care settings, colleges, research laboratories, and home health care agencies. Hospitals and acute care settings employ more than 75% of all respiratory therapists. Respiratory therapy places a high value on life, just as God places that same value in the importance of life as described in Genesis 1:26 through 27, which states that God created man in His own image. A primary role of respiratory therapist is assessment, diagnosing, and treatment of patients. This begins with a bedside assessment of the patient's symptoms, complaints, and general appearance. Along with these demographic data, patient medical history, family history should also be considered. Vital signs such as blood pressure, heart rate, temperature, breath sounds should also be assessed. Review of symptoms includes presence of cough, blood and sputum, chest pain, and shortness of breath, fever, or pedal edema. Depending on these results, additional testing may be required, or consultation with physicians or other support staff may be needed. Treatment of patients depends on severity and degree of symptoms. Treatment options for respiratory therapists include inhaled aerosols, oxygen therapy, non-invasive ventilation with CPAP or BiPAP machines, and mechanical ventilation. Respiratory therapists also perform pulmonary function and bedside mechanical ventilation to evaluate lung function of patients. Pulmonary function tests are used to identify pulmonary impairment and the severity of the impairment. This test is used to identify the presence of pulmonary disease, classify the type of disease, which is either obstructive or restrictive, and the severity of the impairment. Pulmonary function testing gives physicians much needed information for prescribing proper medications such as inhalers. Pulmonary function testing includes several different tests that evaluate various lung functions. Respiratory therapists have to assume responsibility for maintaining a patient's airway in all settings. The majority of patients a respiratory therapists treat have diseased lungs which impair their breathing. Maintaining an airway can be accomplished through suctioning of the airway for sputum or foreign substances. At times, an artificial airway has to be inserted if the patient is unable to breathe on their own. This is performed by a process called intubation. Routes for intubation include the nose and mouth. Ventilatory support can be done through various techniques depending on diagnosis and symptoms. Oxygen therapy is the most common. Mechanical ventilation is used to support the patient until the underlying condition is resolved or maintain support for the chronic ventilatory problem is no longer needed. Non-invasive ventilation is used for patients with sleep apnea, COPD, and to improve mortality in patients with respiratory illness. Among the most common diseases treated by respiratory therapists are COPD and asthma. COPD is a result of chronic bronchitis and emphysema. In the United States, 24.3 million people are diagnosed with bronchial asthma, 9.4 million are diagnosed with chronic bronchitis, and 4.1 million with emphysema. Symptoms of COPD are most prevalent in smokers. Cigarette smoking has been blamed for up to 85% of all COPD cases. Asthma is a primary inflammatory disease of the airways. Asthma is a chronic illness. In 2000, over 4,500 deaths were related due to asthma complications. Lung cancer is the leading cause of cancer-related deaths, accounting for 29%. 90% of people diagnosed with lung cancer have had direct exposure to tobacco. All types of lung cancers have been associated with smoking. Respiratory therapists educate patients on the known health risks associated with smoking. Respiratory therapists are advocates for life. It is their job to educate patients and patients' families regarding information about diseases, medications, and treatment options. This speech has discussed educational requirements, roles, and disorders treated by respiratory therapists. Advancements in technology, along with an increasing population of older Americans, are paving the way for respiratory therapy. Respiratory therapy and care have evolved and changed into an integral part of the medical community. Thank you.